Thank you and good afternoon everybody. So as Linda said, I'll be talking about non-communicable diseases and the global response to date. Let me just check I can work this. So for those of you who don't know who the NCD Alliance is, I'll give you a quick introduction of who we are first. The NCD Alliance was formed in 2009, so we're relatively new. And we were founded by the 4 international NGO federations, which are the World Heart Federation, so cardiovascular disease, International Diabetes Federation, focusing on diabetes, Union for International Cancer Control, and the International Union Against TB and Disease, obviously. And we are a unique civil society network that unites over 2,000 organisations in 117 different countries. We have grown over the last 4 years significantly. At the beginning, we were mainly 1,000 organisations based around the member associations of the federations, and then over the last 4 years, we've really built our network, particularly at the national and the regional levels. And over the last 4 years, we've really established strategic alliances and partnerships, important mainly for our advocacy work, so particularly with the World Health Organization in Geneva headquarters, but also at the regional level, also the UN in New York, and other different UN agencies such as UNDP and UNICEF and UNFPA, which all have a stake in the NCD response. Important governments and political blocs, particularly the Caribbean community, which has been a real leader in the NCD response to date. And important academic groups such as the Lancet, which we've got strong partnerships with as well. And so the NCD Alliance's vision is really putting non-communicable diseases at the heart of national health and development planning, because what we've seen in the last decade or so is that NCDs remain a completely neglected issue for many reasons, which I will explain in my presentation. And that we want NCDs to really be in the mainstream of the post-2015 development framework. Again, I'll explain what this post-2015 development framework is. I'm sure many of you are aware of it. But it's essentially the successor goals to the Millennium Development Goals, which are being negotiated as we speak. And the NCD Alliance works through 4 major strategies. Our first one is where we've really made our name, which is global action, essentially our global advocacy and campaigning work with WHO, with UN, with governments. Our second pillar of work is around national action, so trying to facilitate national activity on NCDs, particularly working through civil society groups. Our third one is building the demand, which is essentially our communication strategy, which is obviously where journalists really come into the picture. And our fourth strategy is around building the alliance, so making sure that we as an alliance have the right governance structure and are partnering with the right people. And so what drives us for the NCD Alliance is a global epidemic essentially out of control, and I'll give you a brief introduction into the global NCD epidemic now. Firstly, what do we mean by NCDs? Just to start off by saying NCDs is a horrible phrase that we've all come to encompass and appreciate, but it's essentially saying that everyone, it's a non-epidemic, non-communicable. In before 2011, it was particularly unrecognised by the general public and by political decision makers as well. But over the last years or so, WHO and the NCD Alliance and many other partners have really tried to raise awareness of what NCDs actually means. And the definition used by the World Health Organization is this 4x4. So what we're essentially talking about is 4 diseases, which are diabetes, CVD, cancer and chronic respiratory, and also the 4 risk factors, which are obviously driving this epidemic. So tobacco use, unhealthy diet, physical inactivity and harmful use of alcohol. So this is known as the 4x4 in the NCD community. Having said that though, even though we kind of use this 4x4 definition, there's a huge selection of other diseases and other health issues that are actually come under the NCD umbrella as well. Mental health is the big elephant in the room in the NCD community, whether we do include mental health or not, including Alzheimer's disease, because there's obviously so many connections between, for example, diabetes and Alzheimer's. And also many other issues such as osteoporosis, which also see themselves under the NCD umbrella. And this is part of the reason why it's actually very challenging to raise awareness of NCDs and to get political commitment on NCDs, because it's such a broad umbrella term that encompasses so many different issues. So the communication behind it is actually very challenging. And so over the last 5 or 6 years particularly, the NCD epidemic has gradually gained in prominence on the international agenda. And Ban Ki-moon famously said in 2010 that the NCD epidemic is a public health emergency in slow motion. And the in slow motion piece is actually really important because this epidemic, there's no kind of magic bullet that you can apply to the NCD response. It's a very multisectoral issue, and it's a very complex issue that actually requires activity across a range of sectors, across prevention, treatment. It's no easy epidemic to be responding to, so it's going to take decades to actually turn the NCD epidemic around. And so what are we talking about in terms of the numbers of the NCD epidemic? Remember, we're talking about cancer, diabetes, cardiovascular and chronic respiratory. We know that NCDs are the biggest killer worldwide today, and they account for 36 million deaths every year around the world, which accounts for 63% of all deaths worldwide. It's also the biggest cause of disability. It causes 50% of disability worldwide. Recently, the UN held a big high-level meeting on disability and development, and the NCD Alliance was there talking about the links between NCDs and disability, thinking about amputations, the importance of palliative care for cancer patients. All of these issues are very connected. And within NCDs, 9 million of them are actually preventable, so before the age of 60. What we know now is that increasingly NCD epidemic is hitting low middle income countries hardest. 80% of the NCD deaths are now in low middle income countries, and we'll see over the next decade or so the fastest rise in low middle income countries. And recently, until very recently, the NCD epidemic was very much seen as a high income country issue, but now we very much see it as a development issue. And within those low middle income countries, it's really the vulnerable communities, such as Indigenous people, that are experiencing NCDs the hardest. And we also know that within the NCD epidemic, it's actually a crisis of our own creation largely. It's driven by globalisation, it's driven by urbanisation, changes in dietary patterns as people move from rural to urban areas, decrease in physical activity, so the lack of transportation systems in cities is a really important contributory factor to the NCD epidemic. And obviously the changing lifestyle habits essentially of people as they are moving into cities, etc. But one of the most important points of the NCD epidemic, which a lot of political leaders are still ready to grasp, is the economic cost of the epidemic. In 2009 and 2010, the World Economic Forum rated NCDs as one of the top global risks worldwide, along with things like the financial economic crisis. So the NCD response, which has been neglected for years, is actually as important and is a bigger global risk as the financial economic crisis. They also estimated that the cost of inaction for NCDs will cost the world 47 trillion over the next 20 years. And that number is pretty hard to get your head around, 47 trillion. It's huge, and it's actually, I think that number actually didn't do a huge amount of help in terms of advocacy actually, because it is too big. It's almost, you know, how do you actually start to respond to this huge economic crisis? And the way that it impacts upon the macroeconomic scale is really through high healthcare expenditure. So within diabetes, for example, the International Diabetes estimates that diabetes causes $378 billion in global healthcare in 2010. But also NCDs impact upon households. So it causes through costs of treatment and essential medicines and technologies. It causes catastrophic costs through mortality and morbidity. And it pushes vulnerable populations into destitution. So for example, in India, 1 in 4 families where a family member has CVD experiences catastrophic expenditure. So NCDs is really a poverty issue, and that until recently hadn't particularly been recognised either. And what this slide explains is that NCDs, as I've said, is really a multisectoral issue, and it's extremely interconnected with many different elements of development. I've already talked about the social dimensions of it, including social determinants of health, the fact that poverty, the fact that inequity increases the risk of NCDs. It also impacts and is exacerbated by environmental factors, such as I've already explained, urbanisation, transportation, air pollution, particularly for lung disease and lung health, and food and nutrition security as well. And obviously the economic impact and the causality of that is huge for NCDs. So NCDs impact upon labour productivity, which is obviously why NCDs are a huge problem for the private sector, because it essentially creates absenteeism in work. It creates healthcare expenditure, household income, it reduces household income, and GDP as well. So this is the interconnected kind of web of the NCD epidemic, and I think again this is a reason for the difficulty of responding to the global NCD response, because it is so interconnected with many different issues. But despite this very complex picture of the NCD response, we do have cost-effective solutions, and we do know what to do. In 2011, in the lead up to the UN high-level meeting on NCDs, which I'll talk about in a minute, the Lancet NCD Action Group and the NCD Alliance produced a paper on priority interventions for NCDs. And we grouped them under 5 main areas. Firstly, we need political leadership, and this is very much similar to many of the other health issues out there, of the real solutions that you need at a headline level. Political leadership is obviously essential, really from heads of government and heads of state level, so going beyond the ministries of health to actually heads of government. Secondly, prevention. We know that the vast majority of NCDs are preventable, and action on tobacco control, for example, can reduce the risk of NCDs. Treatment is critical, and this is an area that we still have a lot to do in, particularly around ensuring access to affordable and appropriate essential meds, and really to strengthen the primary healthcare system for NCDs. Because what we see at the moment is many health systems, particularly in low middle income countries, still being distorted towards providing care for acute issues such as HIV/AIDS. Fourthly, international cooperation. I'll go on to talk about this in a minute, but this is a major challenge for NCDs, the fact that there is very little global funding and global resources for NCDs worldwide. And fifthly, monitoring progress and accountability. Accountability is always key for all health issues. So we do have cost-effective solutions despite the fact that we are faced with this major and complex challenge. However, despite all of these things, the fact that we've got the evidence to show that NCDs is a huge challenge in terms of the impact and the scale, and that we do have the cost-effective solutions, it's been somewhat of a paradox within the NCD response to date. Because essentially what we have is that NCDs are not a global health priority until recently. They were not recognised as a development issue. But they weren't included in the Millennium Development Goals, for example, which were agreed in 2000. HIV/AIDS, TB, malaria, maternal newborn child health made it in there, but NCDs were not recognised as a development issue then. As I've said, we have a lack of global resources for NCDs, so despite the fact that there's going to be a huge economic impact of the NCD epidemic over the next decade or so, we don't have the resources to respond to it. And fourthly, there's no real sense of urgency or outrage for the NCD epidemic. Within governments, for example, they are looking at short-term political cycles of how they can use their health budget to make an impact and to show results. NCDs, for many governments, they see it as such a long-term challenge that they haven't put the investment in. And including, when we're talking about outrage and urgency, we also don't really have people on the ground in the general public shouting and calling for their governments to take action on NCDs, which you could arguably say has always been the case within other health communities such as HIV/AIDS, which is very much an activist-driven movement. And so within this paradox, as I've said, there's the donor funding is a challenge. Where is the funding for NCDs? Within, for example, the bilateral development aid, so the official development assistance globally, 22 billion is spent every year on ODA for health. Within that 22 billion, less than 3% is allocated to NCDs. And that's obviously completely disproportionate to the actual scale of the epidemic, particularly in low middle income countries. And as we can see from this chart, the vast majority of funding is still going to Millennium Development Goal health priorities, which it should do, obviously, but there has been absolutely no shift in global resources towards NCDs in recent years. Also, as I've said, there's a distortion of health systems in low middle income countries. There's a quote that we use quite a lot in the NCD community from Cambodia, which is, a man in Cambodia said, "I wish I had AIDS and not diabetes." This is essentially because there's HIV/AIDS clinics down the road. There's no diabetes clinics for people with diabetes. So there's a huge distortion of health systems, and the fact that most health systems are still oriented towards delivering acute care rather than chronic care, which is required for NCDs. And so, based upon that global picture and the challenge, I'll briefly talk now about what the NCD Alliance is doing and some of the progress that we've made over the last 4 years, particularly in raising the priority of NCDs. So the way that the NCD Alliance works is we have 4 strategic priorities, which I've already explained: global action, national action, building the demand, and building the alliance. And I'll really focus on the global action section for the purpose of this presentation, to talk about how far we've come in building commitment for NCDs at the highest level, both within the UN and within governments, because that's where it really starts for actually accelerating resources, for actually improving programmes on the ground, for increasing human resources for health. Political commitment and leadership is a prerequisite for all that comes before that. So within the NCD Alliance, we have 3 major priorities in terms of global action. We want to secure political commitment and leadership for NCDs. We want to establish the foundations of the global NCD architecture, which I'll talk about in a minute. But essentially what that is ensuring that at the highest level within the UN, we have the main pillars that will basically drive action. So we have accountability, we have a plan, and we have evaluation and accountability, which will then drive action at the national level for NCDs. And thirdly, to integrate NCDs into the development agenda. As I've said, this is a major issue for us. And with the post-2015 development dialogue going on at the moment, we've got a real opportunity to actually change health priorities at the highest level. So the NCD Alliance's work at the global action level really started in 2010, when we first started calling for a UN high-level summit on NCDs. And we did this for many reasons. One of the reasons I've already explained is actually trying to bust the myths around NCDs, to ensure political commitment for NCDs, and to also importantly take NCDs from being seen as primarily a health issue, which the health system has to respond, to being a broader development issue that's actually a whole of government priority and all sectors should be taking account of and interest in. And so in 2011 we called for the UN high-level summit, and we got it a lot quicker than we'd actually thought, through mobilising our huge network and by working with our strategic alliances, including the CARICOM governments. And so in 2011, in September, the UN high-level summit came about in New York. And during that meeting, 34 heads of government and heads of state attended the high-level meeting, which was a significant number when you compare it to other high-level meetings that have taken place. And it did show that there was increasing political recognition for this issue. 133 member states attended and made statements. Many of them, including 43 member states, actually made specific commitments on NCDs. And so this was very important for our advocates at the national level to be tracking those commitments and to be using them for advocacy purposes to remind their governments of what they've actually said and what they should be doing. There was a huge number of side events during that 2-day period in New York, and there was a record number of civil society participation at that meeting. And it was really described by Margaret Chan, the WHO Director General, as a watershed moment with a clear before and after, with ignorance and complacency and inertia replaced by awareness, shock and the right actions straight away. We'd seen the model that we used for actually calling for the UN high-level meeting was the UN high-level meeting on HIV/AIDS in 2001, because we'd seen what had came up, what had resulted and what the momentum had created by that high-level meeting in 2001 for HIV/AIDS. And so we were trying to replicate that for NCDs with our high-level meeting in 2011. And the major outcome or output from that high-level meeting was unanimous adoption of the first UN political declaration on NCDs that was adopted at that high-level meeting. And if you read the political declaration, unless you're a real policy geek like I am probably, it's quite a dry document. It's a political document, but it's really, really important because it's basically the first time that governments recognised NCDs as a development issue and actually committed 22 action-oriented commitments that they are now accountable for, essentially. And the political declaration includes commitments that span prevention, treatment, care, research, surveillance, and the importance of a multisectoral response to NCDs, which has been the real cornerstone of the NCD response to date. and it called on governments to ensure that NCDs are at the centre of national health and development plans, which is really important. It calls for governments to develop and implement national NCD plans within their country. There was a target within the political declaration that all governments had to have an NCD plan by 2013. It's very questionable of actually whether that's happened. WHO estimates that about 80% of countries now have a national NCD plan, but the real problem is implementation. Essentially, only about 40 to 50% of those national NCD plans are being implemented and actually have a budget behind them, which is really critical, obviously, in terms of actually implementation. And what the political declaration did was it really heralded in a new era of political leadership, multisectoral action, and importantly, international cooperation on NCDs. And so since the 2011 UN high-level meeting, which is obviously our big kind of major political milestone in the NCD response, we at the NCD Alliance have been working on two fronts in terms of our campaigning. What we've been doing is trying to keep the pressure on to governments and the UN through these two global campaigns. The first campaign, which is called the Global NCD Framework Campaign, really focuses on ensuring that the commitments made in the political declaration are kept to, and we're going to continue the momentum in terms of that political declaration. The second one, as I've already talked about, is all around post-2015 and development agenda, basically making sure that NCDs are central to what comes after the Millennium Development Goals in 2015. And you might be aware of this huge process going on at the moment, which really started in 2012. These many different political processes of how to define that post-2015 development agenda. And it's obviously really important that we do get NCDs in there, because we've seen how important they are in framing priorities for governments and funding. And so the Global NCD Framework Campaign, the priorities have been threefold. Firstly, as I said, the NCD kind of architecture that we're trying to establish at the highest level at the UN is around these three pillars. So it's around global accountability. To date, we've never actually had any targets made by governments on NCDs. And again, looking at other health issues like TB, like HIV/AIDS and maternal health, we've seen how important targets are to actually improve both data collection, to improve accountability of governments, and to actually give advocates a real target to work towards as well in terms of keeping their own governments accountable. The second piece of the NCD framework is actually to have a global plan in place which sets priorities for all different stakeholders in the NCD response. And the third one is around having a global NCD partnership. You'll have heard much about the Stop TB partnership, for example, the WHO partnership for maternal newborn child health. We've got many examples of partnerships out there which are really multi-stakeholder and include UN, governments, civil society and private sector where appropriate. And this is what has been missing in the NCD response. This is something else that we've been really advocating for. And these are really the foundations or the pillars of the global NCD architecture. And so progress to date, in terms of accountability, at this year's World Health Assembly in Geneva, all governments, all member states of WHO adopted the first WHO monitoring framework on NCDs, which included the first set of global NCD targets and indicators. The comprehensive monitoring framework includes 9 global targets and 25 indicators, and the targets span across prevention and treatment and health system response. The main target that really has captured a lot of people's imagination and is really a kind of rallying point for a lot of advocates worldwide is the overarching target of reducing premature mortality from NCDs by 25% by 2025. Everyone's kind of been calling this ever since the 25 by 25 target. It's obviously a hugely ambitious target that all governments have to report against. But from an advocacy perspective, again, it's a good kind of rallying point to be talking about. Underneath that 25 by 25 target, you've got 8 more targets which span from halting the rise of diabetes and obesity. You've got 25% reduction in raised blood pressure, 30% reduction in tobacco use, 30% reduction in salt, 10% reduction in physical activity, and 10% reduction in harmful use of alcohol, which are obviously the main risk factor targets. And then under that, you've also got health system response targets. So you've got essential NCD medicines and technologies, 80% coverage in countries, which is hugely challenging. And you've got drug therapy and counselling, which is more specific to CVD and diabetes. diabetes, and that's 50% coverage. So these global NCD targets, the NCD Alliance worked very hard to actually influence what they look like. At the beginning, many governments wanted only 5 targets. They were trying to really minimise it. Also, arguably, there was quite a lot of private sector influence around some of the risk factor targets, particularly alcohol at one point fell out of the set of targets due to influence of industry. But what we've ended up with is a really comprehensive set that all, as I said, all governments now have to report to WHO on. And Margaret Chan famously said in 2012, what gets measured gets done, and that's absolutely true, as we've seen with the MDGs. So this is a really important step forward in the NCD response. Secondly, when I was talking about the Global NCD Action Plan, what we have now is a WHO Global NCD Action Plan for the next 7 years, so for 2013 to 2020. Previously, we had an action plan for 2008 to 2015. This one is the new one, and it's a lot more ambitious and a lot more comprehensive. It's really a roadmap for implementing the political declaration that was adopted in 2011 and for achieving those global targets that I just talked about, and that 25 by 25 target particularly. The process of developing this plan has been very long, and civil society has been very much central to it, influencing all the way. It's been a 12-month consultation, and it was adopted again at this World Health Assembly this year in May in Geneva. And it has 6 global objectives within the action plan, which range from international cooperation, creating a multisectoral response at the national level, prevention, health systems, surveillance and monitoring. And importantly, what the action plan does is it includes priority activities for WHO Secretariat, for member states and for international partners, which obviously includes civil society. It includes a huge range of actors as well. But this action plan is really important because it essentially provides our roadmap for where we're going over the next 7 years, and we can really use the activities in the action plan to hold both WHO and member states accountable. Thirdly, as I was talking about, is the Global NCD Partnership, and this is an ongoing process that we haven't come to a final agreement on yet by governments. As I said, we're really basing our work around the Stop TB Partnership as an example, as well as PMNCH and Rollback Malaria. There's many different partnerships based in WHO. And this is really because NCDs are such a multi-sectoral issue that it requires more than just governments to respond. And so this partnership or global mechanism would be a way by all different actors, so UN, governments, NGOs and private sector, get together to really coordinate action and activities on NCDs at the highest level. And so what we've been advocating for in the NCD Alliance is a light touch global coordination mechanism that convenes relevant sectors and catalyses and coordinates global action. And what's expected to happen with this process is in November, middle of November, governments will make a decision on what the actual terms of reference and what this GCM will actually look like. So this is kind of an ongoing process for us at the moment. The second campaign that I talked about was the Global Development Campaign. So we've talked about the Global NCD Framework Campaign, now talking about the Global Development Campaign. As I've already said, NCDs were missing in the Millennium Development Goals, which have really driven priorities and resources in low middle income countries. And they've shown that the MDGs have really increased resources and action for specific health issues such as maternal health and HIV, AIDS and TB. NCDs were included, which has been a huge barrier to political priority and resources. But now we're seeing this post-2015 process, which is an opportunity for us to be ensuring NCDs are central. As I said, the process is hugely complex and it takes more than one staff member's full-time job to actually keep track of all this. So I won't go into a huge amount of detail on it, but just to say that it started in June 2012 with the UN Conference on Sustainable Development, which was Rio +20. Since then, we've had a high-level panel of eminent persons on post-2015, which included the Prime Minister of the UK and Liberia and Indonesia. They came out with their recommendations earlier this year in May 2013. Alongside that, we had global thematic consultations on all different issues. We had 11 global thematic consultations, including one on health, which was something that obviously was a priority for us. And we did see that NCDs were recognised as a priority within that global thematic consultation. And now what we're seeing is an intergovernmental open working group called the Open Working Group on Sustainable Development, which are essentially taking over the baton from the high-level panel to think about actually what those goals and targets should look like for post-2015. But it is very much a moving feast, and it's also a very, very long process because it started in 2012. And actually what we will see is we won't actually see governments agreeing to the post-2015 agenda until 2015 itself. So it's a 3-year process that we've all got to keep our energy up for, because it's going to be a bit of a marathon. And so what the NCD Alliance has done is really establish our vision for post-2015. And so we produced a publication earlier this year which was called Healthy Planet, Healthy People, the NCD Alliance Vision for Health in the Post-2015 Development Agenda. And what that did was really provide the case for NCDs in post-2015, which I think is still an uphill battle in terms of actually convincing the development community that NCDs are a challenge and a priority in low middle income countries, but also including recommendations on specific goals and targets for NCDs and health more broadly. And what we're suggesting is essentially that the post-2015 development agenda adapts and tailors that 25 by 25 NCD mortality target that we've already had adopted by governments for the timescale of the post-2015 agenda, which is likely to be around 20 years. And so in terms of progress, how far we've come in the development campaign, as I said, it's a bit of a moving feast, but the global thematic consultation we've had on health, NCDs was recognised as a priority, and there's increasing interest and support for a goal on healthy life expectancy as the overarching health goal for post-2015. Obviously, at the moment in the MDGs, we've got 3 different goals on health issues. So we've got maternal health, we've got infectious diseases, and we've got child mortality. But now what we're seeing in the post-2015 development agenda is because so many different issues are coming under it, and it's going to be organised under the 3 dimensions of sustainable development, so social, economic, and environmental, that will have an overarching health goal, and then we'll have a number of targets underneath that. And we're seeing NCDs being recognised as a priority for health under those targets. Also, the high-level panel published their report earlier this year, and I should say that you can find all of these resources on our website if you want to have a look further. And the high-level panel suggested, as I said, 3 dimensions of sustainable development being the kind of basis for the post-2015 framework, that there are these 5 transformative shifts that we have to take into consideration, including, for example, leave no one behind, a real kind of equity agenda to post-2015. And they suggested 12 goals and 54 targets. So obviously that's an increase from the Millennium Development Goals, but it's actually not surprising considering how many competing issues there are out there. And I think one of the major changes actually from the Millennium Development Goal process to post-2015 is that it's so much more of an open process that actually NGOs and others can really get into and engage in, compared to the Millennium Development Goals, which was essentially developed behind closed doors in the UN with very little consultation. So we've actually got a really good opportunity to be influencing what comes out. So 12 goals, 54 targets. The health goal, as I said, is being suggested as healthy life expectancy, and NCDs being included as one of the targets underneath that, alongside, for example, HIV/AIDS, TB, maternal newborn child health. And so as we're campaigning, we're obviously maximising political events out there, both for our NCD framework campaign and for our post-2015 campaign. A number of different conferences and UN events over the next 3 or 4 years that will really shape what we get out of these 2 campaigns. And for example, next year in September, we've got the UN review and assessment on NCDs at UN headquarters in New York, which will be a really important opportunity for the NCD community, because it will be the first time that all member states return to the UN to discuss how far we've come since the 2011 high-level meeting, to reassess priorities and to basically redouble efforts on NCDs. So it's important for global advocates and for national advocates, and an interesting opportunity for journalists as well. So we talked about global action and what the NCD Alliance has been doing around global action, and obviously what WHO member states have adopted. But our second pillar of work is around national action. And I'll just talk briefly about these last three pillars of our strategy, because the global stuff is the most important and the one we focused on the most. But national action is an area that we're getting much more into. As I said, we're a network of 2,000 organisations in 170 countries, so we have a huge global presence and a national presence, which is really important. And so what we're doing is really supporting the capacity of those NGOs and civil society organisations, and also really trying to identify and disseminate good practice. Because now that we've actually got NCDs onto the global political agenda, governments are increasingly asking, what works? What can we do? What are the best buys for NCDs in both treatment and prevention? And as civil society, we can be really providing good practice to them, and also supporting them in the delivery of those services as well. And also promoting civil society monitoring. This is an area, again, that other health communities are much more advanced in terms of actually having NGOs holding their governments accountable through scorecards, through different civil society monitoring mechanisms. So this is an area that we're going to be expanding into. But I think the really interesting thing in the national action area for NCD Alliance is the fact that there's an increasing number of national and regional NCD alliances around the world. Obviously, we're the only global NCD alliance, but now what we see is 25 national and regional NCD alliances that have emerged very much on their own, with the support of the global NCD alliance, but very much in their own way, tailoring to their own specific national contexts. And so we've got 4 regional NCD alliances. We've got one in the Caribbean, we've got one in Africa, we've got one in the Latin American region, and we've got one in Europe. And then we've got 21 national NCD alliances around the world. And they all very much differ in shape and size. Some of them are more formal setups, some of them are very informal. But the main purpose of most of them is really advocacy. A lot of them are working very hard in terms of actually providing a joint kind of coordinated platform for advocacy on NCDs, because really until 2009, NCD advocates were very disparate. So you had the diabetes community out there calling for diabetes issues, you had the CVD community, and it wasn't until 2009 when we started to actually come together. And now we're seeing that much more at the national level, which is actually having a lot of really important impact. And I think also governments really appreciate it as well. Rather than having all of these many different NGOs out there they have to talk to, you've essentially got one focal point which you can talk to and facilitate action on. So these national and regional NCD alliances are really interesting and are actually going to be a really important platform for accelerating action on NCDs.
Excuse me. Is it okay if we ask you questions before you finish?
Sure. Yeah.
Like I have 3 or 4 questions I would have asked, but I've already forgotten where the slide was.
Sure. I'll pause now and then I can finish the final bits after your questions. Yeah.
You've mentioned.
I'm going to ask you to limit it to your most important question until we make sure everybody gets a chance.
Okay. Guess what? You mentioned 2,000 organizations, and yet I see disease endemic countries like Ethiopia and West Africa, Central Africa don't have any representation here. How is that?
This map isn't a representation of our organisations. This is just a kind of snapshot of some of the national and regional NCD alliances. In most African countries, we do have some sort of organisation on the ground, whether it be a diabetes organisation or a CVD organisation. They're generally members of our founding federations, for example, the International Union Against TB and Lung Disease. However, obviously the capacity of those organisations is not always particularly strong. And so we're trying to work with many of the organisations in low and middle income countries to try and strengthen their capacity and to learn from other examples from around the world. So this map is definitely not a representation of where we have organisations. For example, in Ethiopia, we have a NCD Alliance in Ethiopia, which is very strong and is doing a lot of good work with the African Union based there.
Other questions? Michael, do you want to keep going, or you want to?
As I said, I've already forgotten what I wanted to ask. That's why I decided I should stop her.
Yeah.
But I assume as you go on, if you have questions, we can stop you and ask.
Just shout. Yeah, that's fine.
And also, I think if you have questions about your specific country that don't get answered here, will you be available for a few minutes?
Sure. Yeah. Yeah. That's fine. Yeah. So, as I said, this is very much a snapshot of the national and regional NCDAs we've got, but on our website we've got the full list, which I can share with you, because they are they'll be a useful source as well for journalists as well, I think, because they're obviously the experts from a civil society perspective in these different countries. And then our third pillar of action or strategy is really around building the demand, which is obviously a really important area from a communications point of view and from specifically a journalist perspective as well. And what this pillar of action is really around, it's our communications strategy. It's, as I said, NCDs are obviously not hugely recognised, particularly by the general public at the moment. The NCD label is not recognised, and so media, international media and national media, and in terms of traditional and social media, is obviously a really good and important platform to be getting our messages out there. And the second kind of priority within this is also really focusing on the voice and the rights of people living with NCDs or at risk. As I talked about previously, the HIV/AIDS community has always very much been driven by people living with HIV/AIDS, and it's been very much an activist movement. Within the NCD response, historically it's really been driven by scientists and physicians. And so what we're trying to do is really try and raise the voice of actually people living with NCDs and to get them much more engaged in the actual policy development, planning and implementation, because we've seen that really works for other health issues and is really important in terms of actually setting priorities for governments. And also in terms of our building demand area, we're looking at kind of brokering knowledge among our network. As I said, we've got this huge network of organisations, and how can we share and promote knowledge exchange between those organisations in our networks. And so the areas that we're looking at, and this is, as I said, an area that we haven't done a huge amount in, and obviously everyone in this room can be of huge help on this, but it's really around a media strategy and turning up the volume on NCDs in the international media and the national media. We did a lot of media work around the UN high-level meeting in 2011, and got a lot of profile and visibility for NCDs. I think the challenge has been kind of keeping that momentum up. The UN high-level meeting was an important kind of political event that you could really get attention from journalists, from decision makers, from the public. I think now it's obviously a challenge to try and achieve that constant momentum. And obviously learning from other health issues, things like highlighting success stories and results to really inspire action is a good way forward, and to leverage key political moments, whether they be at a community level or the national level. And something that we're going to be doing is producing a lot more kind of information materials on NCDs at quite a basic level for general public, including videos, and as I've talked about in terms of actually harnessing the huge social media opportunities that are now out there with Twitter and Facebook, etc. And then the final kind of strategy that we've got, which I'll just touch upon because it's not particularly important for this presentation, is around building the alliance. It's around our own kind of internal organisational strategy to ensure that we're best positioned to be continuing to promote NCDs at the global and the national levels. And it's to really try and strengthen our strategic partnerships with important actors such as the UN, government, private sector and NGOs. Because as an alliance we all know that together we are stronger, that's essentially our mantra, but you obviously have to have the right governance structures in place to actually achieve that. And so I've already talked about the fact that NCDs are a multisectoral issue, and they require action from all different sectors. NCDs are everybody's business, as we always say. So NCD Alliance is obviously working at many different levels within our strategic partnerships with the UN. Talked a lot about WHO, but interestingly, many different UN agencies are now coming into the picture on NCDs. Now what we have at the global level is a UN interagency task force on NCDs, which includes all of the important UN agencies for NCDs, including UNDP, UNICEF, UNFPA, etc., the whole lot, which is going to be a really important mechanism for actually inspiring action on NCDs across the entire UN system, rather than just WHO. WHO is obviously important, but we need action beyond them. Governments, obviously, with the Caribbean and many other important governments that we work with, just is trying to strengthen that partnership and to encourage more action at the national level, because even though we've seen a lot of change at the global level, it's going to take time to actually see it trickle down to the national and to the community level. So working with governments, and particularly with our NCD organisations at the national level, to encourage them to be working with governments. Private sector obviously have a huge stake in NCDs for many reasons, but as I talked about already, as employers, in terms of the impact of NCDs on absenteeism, the private sector has a huge stake, and so there's obviously particularly important forums for the private sector, such as the World Economic Forum, which has taken much more of an interest in NCDs over the last 5 or 6 years, and obviously individual companies ranging from the pharmaceutical sector to insurance, to sport, ranging many different sectors in the private sector. And then civil society is obviously our main constituency, but looking at how we can strengthen relationships beyond the NCD community, because we are quite often practicing to the converted, preaching to the converted, and we need much more interaction and strong partnerships with NGOs ranging across the spectrum of health issues, because obviously we know that NCDs are an issue that is very much closely connected to many other health issues, such as HIV/AIDS and maternal health. How we can work with NGOs on the ground to actually integrate NCD services into existing services that are already there, rather than trying to duplicate and reinvent the wheel. And also in terms of, if you think of the Sustainable Development Agenda, social, economic and environmental, many environmental NGOs are really important for the NCD epidemic as well, in terms of trying to encourage better transport and urban planning, which will actually impact on the reduction of NCDs at city levels and at the national level. So strategic partnerships are obviously really important for NCDs and the NCD Alliance particularly. And I think that's the end of my presentation. Thank you.
Well, now is the opportunity for questions.
As always,
A question.
Yeah.
Just a question.
You're talking about the tobacco use and in the NCD, the salt use is also one of the the debate these days. Like recently there's a Delhi declaration where there's some confusion. How you see that the private players as in the non-communicable disease, because a lot of stakes are also there, but at the very same time, they are also on the edge of.
Sorry, can you repeat this? So what?
Like suppose you're talking about the non-communicable disease, the employers and a lot of people are also working in a private place. But at the very same time, like tobacco use, the tobacco lobby will be affected. When you're talking about the salt decrease, the salt intake, the content of the chips or your pizza or any other stuffs are also actually affected by those things. So how you are actually taking it as a private player?
Yeah, the private sector in NCDs is a very interesting one, and it's been a very hot topic within the NCD community, particularly around kind of issues of conflict of interest. Around when the political declaration was being negotiated in 2011, there was huge issues around whether private sector lobbies were influencing actually what was getting put into that political declaration, in terms of particularly around the risk factors, obviously. But I think what's interesting in the political declaration specifically is that very few political declarations normally actually specify actions for the private sector, because they're essentially documents for governments. Yeah. But what the NCD political declaration did was specifically outline 4 major areas that the private sector had to work on NCDs. And it's really focusing on what the private sector's role should be in the NCD epidemic, which is obviously as employers, which we've already talked about, in terms of providing workplace wellness schemes within their own companies, but also in terms of them being producers, as you've said, producers of food, unhealthy diets, alcohol, tobacco, and the importance of reducing the unhealthy elements of products and trying to make them more healthy. For example, in the UK recently there's been a new responsibility deal between many of the food companies, and they have basically pledged to reduce the amount of trans fats in products. So, for example, Kit Kats with Nestle there, in various different ways. I mean, there's a huge debate about regulation versus voluntary, etc. And different governments deal with it in different ways. But the private sector themselves have to actually take responsibility to be reducing the content, the unhealthy content in their products. So the private sector has a huge stake in it, and obviously not just as producers, but also as providers of health services in many countries as well, and as producers of essential medicines and technologies, which is obviously critical. So private sector is key to the response, but it's obviously how they are involved. And the major issue is obviously where the private sector gets involved in actually policy development. You know, the standard conflict of interest issue is the fact that you need to have a firewall between the private sector and policy development within governments or wherever you are. So it's ensuring that you're managing and actually, you know, seeing the conflicts of interest before they actually happen.
And you talked a lot about, you know, that HIV and tuberculosis and kind of other more disease-specific issues kind of got more attention. And in a way, I almost understand why, because when you talk about NCDs, just from an outsider's perspective, I'm like, wow, you're kind of talking about reorganizing the whole world. You know, you're talking about like making sure that people don't smoke as much and making sure that there's good public transport and that people have access to good chronic care, which is kind of like making the world a better place in a way, which is great, but it's a huge, huge issue. It's not just one vertical program that just requires X drug and X amount of money over X period of time. So, yeah, I just kind of wanted your thoughts on that, and especially for us as reporters, maybe how we could focus on specific things as opposed to my reaction is to be a little bit overwhelmed by the magnitude of the problem and what you would need for a solution.
Mm-hmm. Yeah, I agree that it is, because it is such a huge issue. It's not just a health issue, as I've talked about. It requires action from so many different sectors, and within the governments, it's obviously a huge challenge because we talk about whole of government responses for NCDs, but governments have a huge, you know, ministries and sectors within governments have a huge issue with actually working together. That whole of government multisectoral response is very, very difficult for governments to actually implement. So it is a very big issue to be, you know, for example, reporting on from a journalist perspective. But I think what in terms of the actual reporting, what's interesting, I think, is seeing what's being done, the actual kind of success stories that have actually happened at the national or regional levels or wherever you're reporting on. And focusing on a specific angle, because you could, you know, NCDs, you could talk about it all day, because and where do you actually draw the line? Because you can talk about nutrition, you can talk about transportation, you can talk about urbanization, you can talk about so many different things, but actually focusing on a specific issue within the NCD response, so for example, prevention or treatment and essential medicines. And also, I think where the NCD community has fallen down, and we're trying to improve the way that we do this, is actually providing stories of people, because at the moment, you know, I think probably from my presentation as well, it's all very, very high level, and you're actually not bringing it down to the people and actually what, you know, breast cancer means for a person living in XX country, what it does to their family, what it does to if it impacts upon the breadwinner. Do you know what I mean? So actually just kind of talking about human stories in your reporting to make it come to life, because otherwise NCDs becomes this kind of nebulous issue that it doesn't actually affect anybody.
Listening to you, my impression is that the sort of diseases you're talking about require more education and an effective communication strategy than anything else if ordinary people are to change the way they live so that they suffer less and less from some of these diseases, or if they are to demand a change in things like smoking laws and so forth. Have you any innovations in this aspect of communication strategy? I'm saying it because, like, in much of Africa, the reason why HIV continues to infect people afresh, people who by now should know what they should do to avoid getting infected, is that there's a great deal of superstition. People react instinctively and come up with superstitious explanations for what actually is scientific illnesses. It's not just in Africa. The talk before yours, one of these gentlemen mentioned that in India, it's believed that if you have asthma, you swallow a fish, and that will be the end of your asthma. Pure superstition, of course. So have you anything new by way of communication or education, how you can reach people?
I think the misperceptions and stigma and discrimination with NCDs is huge as well. I think the actual seeing NCDs as a rights and discrimination issue is an area that we actually haven't done a lot in, but it is a massive issue for many people, particularly in low middle income countries really, where people, for example, if you're diagnosed with diabetes as a woman, marriageability is very difficult. So as a woman in India, for example, it would be very hard in some communities to find a partner because you're almost stigmatised for having diabetes, which I don't think actually is particularly well known out there, the fact that this is really a rights issue and it's a discrimination issue, and it affects people in terms of their access to insurance, to education, to getting a job, all of these things. It's really not, I don't think people have put a spotlight enough on the actual rights and discrimination element of it. In terms of innovation and what you can do to change that, I think where the NCD community is having most effect is through social media. And it sounds like an obvious one, and it's not really an innovative one, but it's something that the NCD community historically hasn't done a huge amount in, because it has essentially been driven arguably by scientists and physicians. But what we're seeing now is an increasing number of young people can either affected or connected with NCDs. For example, the Young People's Chronic Disease Network is an interesting network that we're connected to. And they're really using social media to try and change the way that NCDs is seen. Because as I said, the whole NCD label is not particularly easy to communicate. It's people don't go to a doctor and say, I've got a non-communicable disease. They say, I've got cancer, I've got diabetes. So it's the way that we kind of change the branding of NCDs almost at the highest level that I think needs the most focus on. And I think by actually getting the messages to the general public, and particularly to young people as well, because I don't think, it's a horrible term, but I don't think, NCDs by young people is seen as a sexy issue to work in, for example, which is why the Young Professionals Chronic Disease Network is a really important network, because it's actually getting young people into this area to be talking about it and talking how important it is. So those are just a couple of thoughts. I'd be very interested to hear any ideas in the room about innovation around communication of NCDs as well.
Examples that aliens successfully affected or make countries, some countries change their policy?
In terms of policy change at the national level, I think there's been a lot of good examples in terms of tobacco control and changing policies and legislation around tobacco control. I think an interesting example of how civil society has influenced national policy is in China, actually, with the establishment of a really ambitious China NCD plan, which was set up in 2012. And civil society were very much involved in the establishment of that. And many countries are actually looking at the China plan as a really good practice example of what a whole of government plan looks like. Because what we see a lot in terms of national plans is that they're set up and developed and then implemented by the Ministry of Health. As I've said, it needs to be much broader and it needs to be multisectoral and whole of government. And what the Chinese did was develop this plan in collaboration with 15 different ministries within the government. And civil society were really key to that, actually changing the shift from it being seen as a national NCD plan by the Ministry of Health to actually being seen as a whole of government national NCD plan. So that's quite an interesting example of how they've changed it at the very highest level.
Santi, you were talking about the four major diseases where the diabetes and the cancer and the cardiac. But when the overall, when you're talking about the MDG, it's not only related to these four diseases, but there are different other things like mental health, and then your burn, and then the salt intake and other things. how you are planning to get into the MDG? What are the major things? It's not actually specifically black and white in the NCD. So how you are actually convincing the internationally to make it a MDG and take out whether 2 or 3 or 4 things next level.
With the post 2015, it's I won't go into the whole political processes, but the way that our approach in terms of how to convince governments, for example, of the importance of NCDs in post 2015 is always using arguments from the head, the heart, and the pocket. I mean, that's our kind of mantra for advocacy. You've always got to be using messages that hit the brain of a decision maker, that hit the heart. So in terms of pulling the heartstrings, using stories of people living with NCDs, and in the pocket is the economic argument for why they need to actually integrate NCDs into post 2015, because otherwise they're going to see this huge tsunami of NCDs in their country, which will completely cripple their national economies. So it's the whole head, heart and pocket strategy in terms of advocacy. But also, I mean, our major strength in the NCD Alliance is obviously our network. We would be nothing without our network on the ground in those 170 countries. And so it's ensuring that we're providing with our national advocates with really clear messages based upon the head, heart and the pocket, really clear asks of what they actually want in post-2015. So, as I said, yes, as you said, the NCD definition is so broad. What do we actually want in post-2015? I think the realistic answer is we would want to target in post-2015 on reducing NCD mortality. Because the way that so many of these political negotiations are based upon is what's already been agreed and what can we draw from and adapt to this new agenda. And so within the NCD response, we're kind of lucky in a way that we've just had these global targets agreed. And so we've got that 25 by 25 NCD mortality target that all governments have agreed. So it's enshrined in a political document. Now what we need to do is encourage other governments to be integrating that into post-2015. But I think one of the other real challenges in the post-2015 conversations is many of our NCD organisations on the ground have established relationships with their ministries of health. The difficulty with post-2015 is that it's obviously being driven by ministries of foreign affairs or international development. Yeah, exactly. So it's encouraging advocates on the ground to be actually establishing new relationships that they haven't necessarily had before, but still using similar arguments. It's still the same arguments of why NCDs is a development issue, a poverty issue. But it's a challenge in terms of actually creating those new relationships with new ministries.
With NCDs, as you pointed out, you're largely trying to, in many cases, you're trying to change behavior. Eat better, don't smoke, drink less. So those are decisions that need to be made on an individual basis, and granted, there are lots of social things that contribute to that. And on the other hand, you're trying to get producers to change what they're doing, and they of course have huge economic incentives either not to change or to change in ways where they continue to make money. So we've seen in New York and to some extent in Mexico where there have been government initiatives to regulate in ways that would change behavior. You can't buy a huge soft drink. Change production. You have to reduce trans fats in restaurants and so forth. And when you try to do both of those things, what we've seen is people get angry. Don't tell me what I can drink, even if it's good for me. And of course, producers fight back because that's in their economic interest. So my question is, how do you approach that? How do you, you're trying to manage it seems like on a government, on a high level, but what's the strategy for getting the people who are going to be helped to want the kind of help you're offering, and at the same time, get producers to sort of do the right thing?
Yeah, that's a good question. And the approach by WHO is obviously, try voluntary, and then if voluntary doesn't work with the private sector, then regulate. But voluntary has to come first before regulation. But I think the challenge and the important thing that we need to be working on is actually getting the general public to actually demand healthy products to be the default choice in communities. Because until we actually get that, we're going to continue to have this very difficult situation where if governments are trying to reduce unhealthy products or whatever, and then the actual beneficiaries actually don't want that, it's a push and pull factor, tug of war almost. I mean, obviously there's examples of where it has worked very effectively, and the whole nanny state thing is a huge issue. But for example, in New York, Mayor Bloomberg, and I think it's actually at the mayor level that you've actually seen the most impact. Mayor Bloomberg's done huge, impressive things in New York by reducing smoking, and obviously by putting calories on menus within restaurants. But it's obviously not necessarily particularly welcomed by many people in New York. But I think it's the whole building the demand, and it's actually trying to get messages to the general public about the importance of access to healthy products and services, etc., so that they are essentially in line and supportive of changes at the government level. But it's a huge, I don't have an answer for that, do you know what I mean? It's such a huge, complex issue, and it does actually, varies hugely by country as well, depending on the nature of the private sector, the strength of the government. There are many different factors within it, but it's difficult, yeah.
So I would say that is part of the challenge for the journalists in this room. If that message is going to get out, it may start with you.
Yeah.
But the reality is, like in South Africa and in the US as well, among poor communities, being able to buy fast food is a status issue. So for us to be like, hey, it's great to eat healthy food, it's not really the journalist's job.
Well, I agree. Journalists can't just preach to their readers, because who wants to hear that? So, there have to be new ways to get that message out, new ways to talk about it, new people to talk to, new angles to that story. It's a long process. I mean, people, I've seen in my lifetime a change from the time where it was so cool to smoke, and now in many places in the US, if you're a smoker, you're ostracized. There's been a complete flip. Lots of cultural strategies came into making that change in the press.
Things are actually changing from India. I mean, in 90s, I can tell you the Pepsi, the soda, the Coca-Cola and this thing. There was a huge market. In every summer, the people are actually crazy about it. Nobody's thinking about it. It's just like if fashion and status symbol, the people are actually carrying the bottle or the other cup. But now, the companies are also thinking that the most of the people are saying that there's just a pesticide, and there was huge cry on this particular issue. Now, the consumers are also not planning to get into the going for the Coca-Cola or the Pepsi. They are actually talking about some alternates, and now those companies are also because the production and the demand is not there, they are actually shifting to the healthy drinks. So the common lemon cola, or not cola but common lemon drink is actually more famous than the Coca-Cola or the Pepsi.
Yeah.
Is there a final question? No? Okay. Katie, thank you so much.
Thank you.
This was really interesting.